Okay. I'm Dr. Shapiro, and I did the FDA study on the Tripollar device. It's also called Apollo. And what it is, it's third generation radio wave technology. First generation, you may have heard, has one pole on it. Second generation has two poles. And third generation has at least three poles on it. When we did the FDA study, we brought the device into the office, and to see what it would do, we treated one of our staff members just on half the face, just to see how much change we would get. And what we found is by heating the skin with radio wave technology, you actually get an immediate tissue benefit, tissue tightening. And what it does, it takes the collagen and realigns it to tighten it. Then you actually, through the heat, you stimulate collagen to grow, which takes about 3 months to see the benefits of full collagen growth. When we started the FDA study, we treated 17 patients, and the patients were between 25 and 55 years old. And these 17 patients went through 8 weekly treatments. The 8 weekly treatments, each treatment ran probably about 20 minutes to do the procedure, and typically about 10 or 15 minutes of prep work before, between photos, cleaning the skin, and then as Daphne did over here, she put glycerin on top of the skin. The glycerin acts as a coupler to couple the radio wave energy to the skin to get that immediate tissue tightening and then that long-term tissue or collagen growth. When we did the treatments, we treated 17 patients, 8 treatments, 8 weekly treatments, and if you do the math, that's 136 treatments. We did 136 treatments, no complications, which to me was the best part of the device, so we didn't have any headaches or problems along the way. It was our staff that did the treatments. Currently we have an esthetician who does the treatments for us. Very, very simple. Your goal is she's going to use a circular motion to try to disperse that energy. If you hold it in one spot too long, it would be painful. So you want to keep that handpiece moving, which Daphne is doing right now. She'll measure the temperature every now and then. The goal is to get the temperature between 40 and 45 degrees to get the optimum tissue growth. We found 42.5 right in the middle. We wanted to hit that number.
You were able to do that on the face?
Yes, we were able to do that on the face without pain. So we found, some patients when you hit 44 or 45, they would have discomfort, but our goal was to get at least 42.5. And so getting them between 40 and 45 degrees is optimal. Some of the estheticians will kind of hit 40 and take their time. We don't want that. We want to try to get them as high as possible without the discomfort. Okay, the more heat you generate, the more collagen you'll grow. Once we were able to attain those temperatures, the treatments themselves are very, very simple. The patient actually has a handheld device. It's on the side of the machine where they can press a button to turn it off if it gets too hot. In the FDA study, we never had to press that button. So it was painless for the patient. And what she's going to do is circular motion all the way around the entire face. And Daphne is treating the forehead. This patient has opted for the forehead, but we recommend the entire face when you do it. After the treatment, we recommended that people just didn't work up a sweat because we've heated the skin to a certain temperature. We didn't want them to heat it any higher than that. And what we did is we took photos both before and after, and what we found is almost a 2.5 level change in the Fitzpatrick scale, which is from 1 to 9. So in our study, we got almost 2.5 levels of a change, so it was significant. We had independent observers look at the photos. They all saw significant change. More importantly, the patients, we gave all the patients a survey after, and the patients were either somewhat or very satisfied with the results. So 100% of the patients were happy with the results after the treatments, just at different degrees. So very, very simple, no complications. The worst thing that could happen with this procedure is if, again, somebody answers their cell phone in the middle of a treatment, they hold the handpiece too long, and you burn the skin. We didn't allow cell phones in the room for that reason. Not because of the radio wave technology, but because we didn't want anybody to get distracted. Very, very simple. Most of the patients described it as a warm water massage. The skin feels warm, it doesn't feel hot, it's not uncomfortable, felt more like a massage. And
Did you have any anesthetic?
No, no anesthetic at all. And the only topical product we used was glycerin, so no topical anesthesia either. Again, very, very simple. If you look at the different generations of radio wave devices, first generation is very, very high energy through a single pole. Okay? To me, the analogy is if you take a pebble and you drop it in a pond, you'll see this circle of energy going out. You have to use high energy to disperse that energy. So what we found second generation is actually 2 poles. It's like dropping 2 stones in the water. And you can see how much energy is between those 2 stones, a significant amount, but there's still energy dispersed around it. By the time you get to third generation, you can use lower energy, which is much less painful, much less uncomfortable, really, really very simple, and safer to use lower energy. Higher energy, there's always been question about risks of radiation, not with third generation using lower energy.
Treatments?
We did in the FDA study 8 weekly treatments, and that's what we continue to do in our office, 8 weekly treatments. There are some offices that will do 6 weekly treatments. We always do 8, okay? And we do see results after the first treatment, but really to maximize the benefits, we found that 8 treatments works the best. Any questions at all in terms of it? Very, very easy to incorporate into the office. The analogy for me with this device would be like microdermabrasion. Microdermabrasion, very simple device. You can bring it into the office, low risk, high benefit, patients were happy, and it paid for itself within a short period of time. This type of device is the same thing. For us there was no risk. Really we had no complications along the way. I think one patient in the study had redness for a couple hours after. Typically the patient will experience redness for maybe an hour after the procedure. Other than that, not an issue at all. And redness is pretty much expected because you're rubbing something with warmth on the top of the skin. Again, just like a massage. Any pain or discomfort? Okay, great. And Daphne, any issues or anything?
No, Sarah wanted just this area treated.
Okay.
So that's what I'm doing.
We have 3 different handpieces. This is the finest one, and this is great for around the eyes. So if she's going to go into the orbital region, she'll use the smallest one. She'll use this one for the cheeks. And sometimes what we do is we'll use the bigger one. If you pull out the bigger one, we'll use that just to get to a baseline temperature.
What if they had fat injections or implant?
Okay. Interesting question. She asked about fat injections or an implant. Implant like a surgical implant or like a filler? Okay. In our study, we didn't see any problems with that at all. Theoretically, with a fat implant, some of this energy does get down to the fatty layer of the skin, but fat injections will typically only last 3 to 4 months anyway. So those patients, they can either wait through 3 or 4 months and do the treatment. That way there's no question or no issue. So if a patient came into me today with the work that I've done with it, I'd say, hey, wait the 3 months, don't do your next fat injection, let's just go straight over here. As far as fillers go, we actually continue to do the treatments. I don't see any issue between fillers. No, I don't see any effect on fillers at all. Really, if we're building up collagen in the dermal layer, it's not going to affect the hyaluronic acid products. Okay, and we treated them along the way, again, without any issues. So we continue to do that. As far as topical products, we don't want them to come in dry or peeling. So we'll stop Retin-A or their topical skincare within 72 hours of the treatment.
Some of those have lead in them?
Yeah, she asked about tattoos and what the radiowave technology would do to tattoos. We've treated actually abdomens with it without an issue over tattoos. Some devices you have to be very, very careful in this area. This, we're just realigning collagen underneath. We're not getting a burn on top of the skin or a blister or anything that would interfere with the tattoo. Okay. Those are good questions. Yeah, okay. Any other questions along the way? No, okay. As far as the device goes, tissue tightening with 3rd generation technology can be used well with other treatments too. There are devices now that will reduce the fat in the abdomen and to get tissue tightening at the same time. So this is something that works well with other procedures. Okay.
One other question. Relative to the thyroid, how close do you go to the thyroid?
She's asking about thyroid, how close do you go to the thyroid? The energy here is dispersed in the skin. If somebody has a history of thyroiditis or thyroid cancer, I wouldn't treat over the thyroid. If somebody does not have a history, I wouldn't have a concern with low-level radio wave technology going over the thyroid. So if they have a history of a thyroid problem, we stay away.
How about like somebody had a neck cancer with radiation?
I wouldn't, if somebody has had cancer in the area, I would not use it over that area. And the real question to me is, I don't...
If they've had radiation, will it make the skin worse?
Okay, if they've had radiation, will it make the skin worse? Well, radiation itself, radiation long-term, gives tissue tightening. So if they've had radiation for a cancer, they're usually not looking for this procedure. If they've had cancer in the area, I wouldn't use anything with radio wave technology over the top of it. Not because I believe there's a risk, but I believe when somebody gets a cancer, they always look for some other cause for it. So to give an example, for breasts, 1 in 9 women get breast cancer. I wouldn't use this over breast, not because I think this has a risk of breast cancer, but if they get breast cancer, they're going to look for something else to blame. They'll look for a device like this to blame. Okay.
Burning the skin or getting hyperpigmentation from previous burns?
She's asked about hyperpigmentation from previous burns. If there's a change in color, this doesn't affect color of the skin, I wouldn't have a concern. So if somebody had a sunburn, for example, a 2nd-degree sunburn, and they had a modeling of the color of the skin, I would still use this in the area. If somebody's had a skin cancer in the area, I wouldn't use this in the area. Okay. Those are good questions. Really, if you think about it, we're tightening the epidermis and the dermis. We're not really going beyond that. But again, if there's going to be an issue down the road, people will always come back to say, okay, what did I do there? So, and that's why when I first saw early devices used over breasts, I always had that question because the first time I ever saw it, it was actually a breast lift done with first generation radio wave technology. And when I saw that in a lecture here at the AAD, I sat there and said, wait a minute.
Breast tightening?
Yeah.
I mean, it may be an off-label question.
No, what was this?
Breast tightening?
Yeah, they were using it for breast lift. And actually I saw a video at the AAD of first generation doing that. Wow, that's fantastic. But then I started thinking about it. With 1 in 9 women developing breast cancer, that's not a great place to use it.
You don't want
and then,
you don't want the liability.
Right. And then actually the doctor who did that original work is from San Diego. And he came out in a lecture like the following year, a year later. Yeah. And he said I wouldn't use it over breast anymore. But he had a great video at the beginning of probably about a 5 or 10 millimeter breast lift. Infrared over the breast, interesting. Infrared hasn't been associated with cancer, but there's always going to be that question because you have deeper penetration. I probably wouldn't use infrared over breast tissue either. So like I said, 1 in 9 women right now are developing it. We don't know why, but 1 in 9 women are developing breast cancer. So we won't treat over that area. Okay.
What other contraindications?
Contraindications for this? If they have a history of cancer, a medical condition in that area, if they have connective tissue disease. In our FDA study, we didn't treat women who were pregnant, people with connective tissue disease, people with active skin infections in the area. These would be the contraindications to it. Okay, and I think most of it's common sense. If somebody comes in and they've got a cold sore right here, you're not going to do the treatment at the time. Diabetic patients, we didn't feel that they would grow collagen as well. So we screened those out for the FDA study. Would I treat a diabetic patient? If they're under control, I probably would treat them. And I have some patients right now that I can walk in the room and I can tell if they're under control or not under control, but I'll still ask what their sugars are on. But I just would explain to a diabetic patient they're not going to grow collagen as well in that area. Okay.
Is it the same type of strength that you use on the body?
She's asking if it's the same type of strength. What changes is the size of the handpiece, because you're treating a larger area and you're trying to get to your target temperature.
So basically it's the same way?
It's the same technology, same technique, but a larger handpiece. If you have a free left hand, can you pull out the largest one? This is the one that you would use on the body, and you can see the difference between the two of these in size. So this is for a finer area, this is for a larger area. And if you think about it, the abdomen you're treating from here to here, trying to get to a target temperature of around 42 or 43 degrees. So you've got to really have a larger handpiece, moving a little bit quicker, but with a larger handpiece you're able to generate that heat. With a smaller handpiece, you're treating a smaller area, so when it gets to the forehead or the face, you'll be using the smaller handpieces.
So therefore it's the same technology, however in the body it's reducing fat?
Well, she's asking about the rest of the body. When you're treating the body, are you reducing fat in that area? With that larger handpiece, you are delivering deeper energy. So you can reduce fat in that area.
But you're not reducing fat on the face?
No, we're using a smaller handpiece. Yeah. Down the road, there will be things that will tighten superficial and deep at the same time. This is meant more superficially, but there is reduction of fat as well at the same time. And if you go to YouTube, there's actually videos where you're reducing cellulite with this device.
And if someone wants to reduce the fat under the chin?
When she's asking about reducing fat under the chin, which is a great question. When we did the FDA study, we treated over the jawline. Wherever you have bone, okay, and tissue on top of it, you get a greater tightening in that area. So for the orbital rim in through here, or the jawline in through here, you'll get better results. So we specifically treated that area because we knew we would see that in the pictures as well. So when we treated the full face, we don't stop at the jawline, we go over the jawline because we'll get a little bit more tightening there. This is great.
How about maintenance during time?
The maintenance of the device?
No, the maintenance of...
Or the patient. Okay. He's asking about maintenance of the patient. And that's actually a good question in the sense that we treated them once a week for 8 weeks. And then there are some patients who ask, what can I do to maintain this after? We recommended once a month. Okay, and there are some patients who will want to come in every week after that, and we tell them, no, let's just back off what you have, because you can only grow so much collagen. Personally, my belief is once you grow collagen, you have to give the body a little bit of rest before you start up again. So I think giving them a month break before you do the next treatment is the right way to go. And then getting into what's called, we call it a collagen maintenance therapy, where you just come in and do it once a month after your series of 8 treatments.
And how much do they pay for facial treatment?
He's asking about how much do they pay for a facial treatment. And what we do, it's 8 treatments, and we'll charge $250 a treatment if they pay in advance.
Sorry?
$250 if they pay in advance. So for the 8 treatments, it would be $2,000. If they want to pay as they go, it's $300 a treatment. We charge $2,400 for that. I think it's all based on market. I think some markets may charge more, and I think that's probably a very reasonable price.
So do they need to come back every few years then, or how?
Yeah, she's asking if they have to come back every few years, and I think that's a good question. When you grow collagen, I tell patients that you're always going to be better than where you would have been because you have more collagen than you had before. But how long it will last depends on how long your collagen lasts. So I think coming back and doing it again is a good thing. One of the analogies that I use, if you're 80 years old and you look 20, okay, you've taken great care of your skin. To do your 8 treatments will last you many, many years. If you're 20 years old and you look 80, you haven't taken care of your skin, you've been in tanning salons, things like that, you're going to have to do the treatments more often. So it's going to depend on that patient.
He's laughing at my questions.
What was that?
I said he's laughing at all the questions.
No, it's a good
I'm not paid
thing.
to be here.
No, it's a good thing.
I have no association.
No, it's a good thing. Does anybody here use other tissue tightening devices at all? Lasers, anything like that? I can speak from my experience on that. We use non-ablative lasers to reduce wrinkles. And you have to reduce collagen or increase collagen by 28% to see a visual change with your eye. The non-ablative lasers, we're lucky if we see that 28%. Some patients will get 30, 35%, and you can see it with your eye. Some patients, you've grown collagen, but you can't really see it. With this device, never been an issue. It's visible to that person from day one, which we know we're growing at least 28% collagen to be able to see that visible change. So here, what we did when we first brought it in, as I mentioned before, we treated one of our staff on half the face. And when you treat half the face, you can compare the difference between the two sides. And that was a great introduction to get our staff on board and fired up to do this treatment. So, I don't recommend treating patients a half a face, but if you want to get people kind of to see the change, you can really see the change immediately. People walked out, and I have one of my patients has a husband and 2 sons who are very negative with her. And she said within 3 or 4 days they came back and said they saw changes. And she said of everything she had done, even Botox or fillers, they never admitted they saw anything. But with this device, you're able to see something with it. So I think that's a great benefit, that you can see it with your eye, and when you see it with your eye, you know you're growing at least 28% collagen. So, and that's with each treatment. Well, I'm going to stay here and answer any questions if there's other questions and things along the way. In the meantime, if you want to come closer and take a look at the treatment itself, you can actually see that we're developing a little bit of redness in that area, but no pain or discomfort. She's not grabbing her fingers, so that's always a good sign.